Is your cleanser doing enough for your sensitive skin? Give your skin complete care with dermatologist's most prescribed Cetaphil Gentle Skin Cleanser. It defends against 5 signs of skin sensitivity and actively hydrates as it cleanses. Don't settle for less. Give your sensitive skin everything it needs. Cetaphil, dermatologist's most prescribed complete care for your sensitive skin. Is your cleanser doing enough for your sensitive skin? Give your skin complete care with dermatologist's most prescribed Cetaphil Gentle Skin Cleanser. It defends against 5 signs of skin sensitivity and actively hydrates as it cleanses. Don't settle for less. Give your sensitive skin everything it needs. Cetaphil, dermatologist's most prescribed complete care for your sensitive skin. Is your cleanser doing enough for your sensitive skin? Give your skin complete care with dermatologist's most prescribed Cetaphil Gentle Skin Cleanser. It defends against 5 signs of skin sensitivity and actively hydrates as it cleanses. Don't settle for less. Give your sensitive skin everything it needs. Cetaphil, dermatologist's most prescribed complete care for your sensitive skin.
Good afternoon, everyone, and welcome to Magbidahan sa Kalusugan ng Pamilya Ngayong Pandemya. A project brought to you by UPIS 1996 as part of their pledge to give back to their alma mater and the community as they celebrate their 25th high school reunion.
This webinar was made possible thanks to our generous sponsors from Galderma. We would also like to acknowledge the warm participation of our family and friends from the UP community as we learn how to take care of our health during the pandemic.
Hello, I am Faith Navarro.
And I am Dwayne Bernardo, your hosts for today.
And Sir Dwayne, actually you are from UPIS batch 96, right?
Yes, I am.
Meron ba kayong mga fond memories noong 96?
Wala tayong oras yata para if I'm gonna name all of the fond memories that I have about the school. Pero well, just like all of my batchmates, I think I can speak on their behalf that we are all very proud of our school. Yeah. So ngayon, it's time for us to give back to the school, and one of the things that we're doing is this webinar nga, to impart yung mga knowledge na from people from not just from our batch but also from other alumni of UPIS.
Thank you so much, UPIS Batch 96, for giving us this webinar for free. And also, we already have 59 participants in here. Welcome,
Yes.
welcome. Maraming
Good
salamat po
afternoon,
because
everyone.
you made us part of your afternoon. And to make our webinar smooth and in order, we just have a few reminders. Sir Dwayne?
Yes. Please keep your microphones on mute and your camera off, especially when the speakers are presenting.
And then feel free to use our chat room to engage in webinar-related discussions. Please avoid using it for personal conversation.
Of course, we encourage you to take notes while listening. We assure you that the webinar will be as informative as it is enjoyable.
Siyempre, habang nanonood tayo ng sessions, mamaya may mga tanong talaga nang mapupunta sa isip natin. Well, we have our question and answer portion for that. We just have some guidelines. First, questions can be submitted by clicking the Q&A box.
Yep, and then selected questions will be read after each lecture to be answered by the corresponding speaker.
And other questions that couldn't be accommodated during the Q&A portion due to time constraint will be answered by the speakers through the Q&A box. And of course, we would like to thank you for coming by having a raffle draw. There will be
having a raffle draw later on, of course, sponsored by Cetaphil. The raffle winners will be drawn from the registered audience, and they must be present during the draw. If your name is picked, you need to be here. First 10 winners will be announced right before the first Q&A, while the second batch of 10 winners will be announced after the second Q&A.
They should acknowledge on the chat box until the second Q&A ends. So kindly chat us your name, number, and address through the panelists chat.
So, and then those who weren't chosen will have a chance to be picked if some wouldn't acknowledge after the second Q&A. So it's important that you let us know that you are here and give us those details para maging eligible kayo for the prize that you were drawn.
And actually, Sir Dwayne, you were part of, although behind the scenes, part of the first webinar. This is our second webinar for Magbidahan sa Kalusugan. The first one.
Tama. I actually attended the first one.
Sana po na-enjoy niyo yun, Sir Dwayne.
It's very informative. That was yung maskne, di ba?
Maskne, eczema, and nutrition with, of course, our experts, our doctors.
Right. Okay. Now, this time around, we get to talk about pregnancy and mental health of teens during the pandemic with doctors. To officially open today's webinar, Magbidahan sa Kalusugan, Kalusugan ng Pamilya Ngayong Pandemya, let us hear from Joy Cruz, the overall chair of UPIS The Best.
Magandang araw sa inyong lahat. Ako po si Joy Cruz, ang homecoming chairperson ng UPIS Batch 96 ngayong 2021. Narito po tayo muli para sa ikalawang yugto ng ating webinar health series. At gusto ko magpasalamat sa bawat isa sa inyo for joining us this afternoon. Kung unang beses pa lamang namin kayong makakasama, you will discover what those who attended the first webinar learned. That this afternoon will be filled with very helpful information that will guide you through this pandemic. Isang malaking pasasalamat sa ating mga resource speakers, Dr. Faye Cagayan and Dr. Jimmy Dumlao II, for sharing their knowledge and expertise with us this afternoon. Special thanks also go to our sponsor, Galderma Cetaphil, for providing the amazing raffle prizes we'll be giving out later. Ang topic natin for today ay tungkol sa pangkalahatang kalusugan ng mga pregnant and lactating moms. Pero pag-uusapan rin natin kung paano alagaan ang mental and emotional health ng ating mga anak ngayong pandemic. Even if you don't have kids yet or you're not even pregnant, sigurado kaming marami pa rin kayong mapupulot na aral ngayong araw na ito na makakatulong sa inyo as we all go through this pandemic together. Marami rin kasi talagang naapektuhan itong pandemic na ito. Isa na ang mga students and teachers ng UPIS who are currently facing the challenges of distance learning. At kung maaari din kaming humingi ng tulong sa inyo, we'd also like to ask for your support sa aming fundraising efforts to provide them with laptops, tablets, and internet connectivity. So please, if you have time and the resources, kindly visit our website at upisthebest.com to learn more about how you can help the students and teachers of UPIS. Muli, on behalf of UPIS Batch 1996, nagpapasalamat kami sa inyong lahat for joining us this afternoon. And we hope that you will learn a lot today. God bless.
All right, thank you so much, Joy, for that wonderful message. Just like what she mentioned, our fundraising efforts for the students of UPIS are still ongoing. So you may visit our website, www.upisthebest.com, and go to the donation page. We also still have some merchandise for sale in our website. All proceeds on the sales of those merchandise will go towards the fundraising efforts of UPIS Batch 1996 for the students of UPIS. And so now, without further ado, we will begin our session. Let me introduce our first speaker. She is a professor and vice chairman or chairperson of the Department of Pharmacology and Toxicology at the University of the Philippines College of Medicine. She is the producer of Usapang P, Puso, Puson, Puerta at iba pa sa DZUP 1602. She is also a recipient of several Gandingan Awards from 2018 to 2022. She is the author of the book OB Pearls and other textbooks and chapters in books, local and international peer-reviewed journal articles. She is an awardee of Asia and Oceania Federation of Obstetrics and Gynecology, Young Gynecologist Award in 2009, National Academy of Science and Technology Outstanding Young Scientist in 2008, and Philippine Obstetrics and Gynecology Constantino P. Manahan Young Researcher Award in 2008. That was a mouthful. So from UPIS Batch 1996 and Intermed 1993 of the UP College of Medicine, please welcome Dr. Faye Samadan Cagayan.
Ayan, Dwayne, thank you for that kind introduction. Parang hiningal ka po yata doon. Oo,
Makadami
diba?
niyo
Parang
namang
kinuha mo na yung kalahati ng time ko
accolades,
para sa lecture ko. Anyway, salamat for that. And magandang hapon po sa lahat ng nandito sa webinar ngayon. Napakalaking privilege and honor for me to be invited, no? And to also help in some way in terms of raising funds for yung minamahal nating UP Integrated School. Napakalaki rin ng bahagi ng buhay ko ang inilagay ko sa sa ating UPIS. So allow me to share my screen para hindi na rin magtagal ang ating balitaktakan. So ngayong hapon po, ako po ay naatasan na magbigay ng kaunting kalaman tungkol sa epekto ng pandemya sa ating pagbubuntis, sa pangangalaga ng kalusugan po ng mommies. Okay, so ito lang po yung magiging short outline po ng aking talk. I would just like to share with you how COVID-19 has affected pregnancy and breastfeeding practices, how we are dealing with changes in terms of checkups, prenatal checkups, and labor and delivery. So general tips on well-being as well. So I will also share with you proper nutrition. And of course, ipapakilala ko na rin po sa inyo yung aking isang parang napakahalaga, no, yung sayuntis or sayaw ng buntis na bilang isang part po ng active lifestyle. So let us first go towards a discussion on prenatal checkup. Sabi nga po ng UPIS chairperson natin si Ma'am Joy kanina na kahit na hindi pa po kayo buntis at this point, o di kaya sigurado po ako na meron po kayong kakilala, kapatid, kamag-anak na buntis or mabubuntis, no? So you can actually share with them the learnings that you will be having from this short webinar. So there are a lot of changes that have been going on, changes in the way we practice our caring for mothers at this point in time since last year of the pandemic, no? So what do we do when we find out that we are pregnant? Of course, hindi naman po nagbabago na kailangan pa rin po nating maghanap agad-agad. Once we find out that we are pregnant, we have to really look for a healthcare provider. Hindi po kailangang obstetrician. A generalist will do, especially now that we have difficulty with the pandemic, no? And we have to continue with our prenatal checkup. So whatever our healthcare provider will instruct us, we have to follow that. And of course, we have to include our partners, our spouses, our family members in preparing preparing our birth plans. Napakahalaga po ngayong pandemic ang magkaroon ng magandang social support. And of course, proper nutrition and active lifestyle will always be part and parcel of this discussion. Now, why do pregnant women have to be extra careful during these times? Even without the pandemic, we consider pregnant women as having a lowered immune system as compared to the non-pregnant women and general population because of the different changes that the body undergoes. So meron po mga pagbabago. You have a new life inside of you. So especially so during the second and third trimester, no, we are more predisposed to severe forms of respiratory infections, and that is COVID included. Okay, so sa ngayon po, ang mga nakikita pong pag-aaral, early part noong pong last year, hindi po masyadong nakakakitaan ng adverse effects ang COVID-19. Yung unang-unang type of COVID-19 last year ay parang pag nakita po natin, hindi naman masyadong ganun kalala yung epekto sa mga mommies natin at saka sa babies. But now with the surge of Delta, the Delta variant, we are seeing a lot of mommies succumbing to this deadly infection. And the different complications that may arise from COVID, if you ever get infected with COVID, become symptomatic, you can have a lot of complications like preterm labor, you can have increased incidence of hypertensive disorders, yung tinatawag po nating preeclampsia. Okay, so tumataas po yung chance na i-refer po tayo sa higher care centers, even admissions to intensive care units because of COVID, no? Although rarely, kasi po bagong-bago pa lang po ang COVID ngayon, nakikita rin po na baka pwede rin siyang i-transmit sa ating mga babies, especially during the third trimester. Now, okay, paano po ba natin note kung COVID po ang ating pine-present? There are a lot of signs and symptoms that a normal patient who is pregnant may manifest, and it can overlap with COVID-19 signs and symptoms. Ano po ba yon? Okay, so minsan, di ba, habang lumalaki po yung tiyan natin, we may present, no? Pregnant women, especially during the third trimester, may present with shortness of breath, fatigue, no? Swelling, yung parang namamanas po tayo, masakit ang ulo, and even muscle pains. Sometimes, normal mommies can feel all of these discomforts. But some of the discomforts will now be term pathologic, or parang talagang pag-iisipan na po natin ng COVID kung meron po siyang kasamang lagnat, loss of smell or even taste, pagtatae or diarrhea, especially so if you have chest pain and difficulty of breathing. These are all things that a normal pregnancy should not have. So we actually say na meron tayong warning signals, warning signs in pregnancy, and fever, diarrhea, difficulty of breathing. These are all part and parcel of the red flags that we usually see, no, in abnormal pregnancies. So sino po bang mga mommies ang dapat tinetest for COVID? So any pregnant woman that is symptomatic, meaning the symptoms or the manifestations that I have already told you in the previous slide, yung lagnat nga po, nahihirapan huminga, okay, ubo, sipon, okay, those women should already have testing done on them. Kapag po tayo ay with high exposure to COVID-19, whether we are asymptomatic, meaning hindi naman po tayo nagmamanifest ng kahit na anong symptoms, then we should also get the testing done. Now, one thing that this pandemic has done in pregnancy is that, I don't know, for those who are logged in right now or tuning in, watching us, and have just delivered or will deliver quite soon, I'm sure sinabihan na po kayo ng mga OBs nyo na just before kayo a-admit sa hospital, especially if you're already term, you will really be required to undergo RT-PCR testing, whether you are manifesting COVID symptoms or not. So it's already a routine tests that will be requested for you if you're going to be admitted in a hospital. So kahit naman po hindi po yung mga buntis, anybody here in this webinar, if you're going to be admitted in the hospital, imposible po na hindi kayo hihingan ng RT-PCR. Remember, hindi po ito rapid test lang, hindi po talagang RT-PCR po ang kailangan to be able to check for your COVID status. So, especially if you are also a frontliner and then you are pregnant, then siguro nakailang beses na rin po kayong testing at as of this time. I actually know a lot na more than 5 tests na in the span of this almost 2 years of pandemic. So as I have mentioned, these are the available tests that are present. You're already, I'm sure, familiar with all of this. Yung antigen test, usually kapag ka magpa-positive po sa antigen test sa community level pa lang, dinadala na po agad sa quarantine facility ang mga yan. Although hindi siya talaga yung parang confirmatory, because the confirmatory test is really the RT-PCR. So these are all available. And then if the mother has other complications, may mga iba pa pong tests na pinagagawa such as chest x-ray and etc. So pagka po manganganak naman, no, for COVID, definitely mas maganda po na hindi sa bahay manganganak. Okay, whether or not may COVID or hindi, we are actually encouraging all mommies to make sure that you have deliveries in lying-in centers or birth centers depending on the risk or complications in your pregnancy. So again, very, very important that you will have your regular prenatal checkups. Ang isa po sa innovation ngayon during pandemic regarding the prenatal checkups is this. Kung noon po ay mayat-maya, parang every month we have to go to our doctors for the face-to-face prenatal checkups. Ngayon po, nilimitahan na po namin mga obstetricians ang face-to-face checkups. We make sure that we let you come in on very, we make sure that the timing is quite significant. Kung kunyari, sabay-sabay na pong ipagagawa yung mga tests such as the blood tests, the ultrasound, if you want to know how your baby is, the sex of the baby, the growth, okay? Para hindi po mayat-maya ay kailangan yung pumunta sa isang health facility. But it doesn't mean that you cannot consult via the consulting platform or remote platform. So a lot of doctors now and healthcare practitioners have converted to a remote platform for consultation. So you can still utilize this para po makapagpa-check up sa ating mga doktor. Okay, and make sure no na nagawa niyo na po yung mga birth plans niyo malayo pa from the time na makakapanganak kayo, ay naplano niyo na po kung saan kayo manganganak. Now, pwede po bang mag-breastfeed kahit na COVID positive? Definitely, the answer for this is yes. No? So breastfeeding, whether or not within the pandemic, actually will improve the health and development of our children. It improves the child's resistance by improving also the antibodies that comes in, that is shared to them by their mothers. So importante yun dahil pati po yung incidence ng mga sakit tulad ng diarrhea, no, gastroenteritis, mga pneumonia sa ating mga babies, even sudden infant death syndrome may actually be decreased because we are breastfeeding our babies. Now, what if the mommy is COVID positive? Parang nakakatakot ano, parang ngayon nga medyo kulang pa rin ang kaalaman ng mga karamihan na pwede pa rin mag-breastfeed si mommy kahit na COVID positive siya. So usually pag napanganak naman si baby, pinapatest din si baby. Kung pareha silang COVID positive, edi tuloy lang, isasama pa rin si baby sa kay mommy, and then tuloy din lang ang pangangalaga sa kanila. But if the baby is COVID negative, there are some options. The mother can actually have physical distancing from the child, no? Kaya nga itong mga usapin na ito, even before the mommy gives birth, you have to already discuss with your obstetrician what to do in these case scenarios. So the mom can actually wear her PPE, her surgical mask, kapag lalapit siya sa anak niya para magpasuso, no? And then kailangan mag-wash ng hands and sanitize them. And of course, follow the minimum health requirements. parents. If you do decide na parang hindi ka komportable na magpapa-breastfeed ka, especially if you are COVID positive, you can still give your breast milk. Okay, so you can use breast pump for your milk. You can still wash your hands, and then you can use droppers, no, to be able to give this to your baby. So hindi naman tayo, maraming ways po para maibigay pa rin natin yung gatas ng ina sa kanyang sanggol. Okay, so hindi at this point po kasi napakaraming mga issues, napakaraming issues na kailangang isipin, especially if the mommy is severe COVID, hindi makakapagpasuso talaga because of her conditions, then wala pong choice kundi gumamit po ng milk from a breast milk bank or share po galing sa ibang mga mommies. And talagang kapag no choice po talaga, ay gagamit po talaga ng milk formula. Ang isang mainit na usapin din po ngayon ay ang tungkol sa pagbabakuna kay mommy. So COVID vaccination. So ang una pa pong tanong ay, kapag po ba buntis ay pwede po bang magpabakuna? Nung una pong dumating ang supply ng mga vaccines last March, nakita nyo naman po because of the limited number and availability of vaccines, ang inuna po talaga at that time were the frontliners, so sa mga healthcare workers. Dahil ang initial reports po ay hindi naman masyadong malala ang mga sintomas sa mga mommies, hindi po sila nakasama sa listahan ng DOH ng mga babakunahan. Okay, but as during the past few weeks, nakita po natin na dahil sila ay naiwan, so as you probably know by now, sino po ba yung mga hindi pinalalabas? Yung mga buntis, yung mga bata, age below 16, at saka yung mga matatanda. No? So ang mga naiwan po sa babakunahan ay yung mga buntis. Okay? So akala po kasi natin dahil hindi naman sila lumalabas, ay hindi sila masyadong tatamaan ng COVID. Yung po ay mga unang pag-aaral. But now, we have seen that with this Delta variant nga po, ang dami na rin pong mommies na tumaas po talaga ang admissions namin, even in PGH, admissions of severe COVID in pregnant women. In fact, we have a few of our own colleagues, mga obstetrician gynecologists who were also pregnant already in their third trimester. And yes, unfortunately, namatay po sila at around 35 to 36 weeks. So I think I know personally, I know 2 of these colleagues who died while pregnant. So pati po yung baby nila sa sinapupunan ay namatay din po. So because of that, pong August ay naglabas po ngayon ang DOH ng additional guidelines regarding vaccination for pregnant and lactating mothers, so pregnant women and lactating mothers. So ibig sabihin, pwede na pong bakunahan ngayon because all the vaccines that are available under the EAU, yung emergency use EUA, emergency use order kasi ay pwede naman po. These are all not live vaccines except for Sputnik lang po ang nagsabi na hindi sila pwede. Okay, for now, yung pong Sputnik ay hindi po pwede. So ito po yung guidelines for the vaccination in pregnant women. We usually advise that we can start the vaccination kapag more than 12 weeks na ang mom. So after the first trimester, because it's during the first 3 months that the baby's organs are developing. But if you are deemed to be high risk, for example, noong March po, even doctors, nurses, frontliners who are pregnant were already being given vaccines. No? Ito lang pong mga nasa community, ngayon lang pong mga bandang August nagsimula ng vaccination. Okay? Kasi nga po, at a higher risk po sila. So now, they are considered part and parcel of the A3 expanded category for vaccination in the community. So yan na po yung issues natin on vaccination. So kung meron po kayong mga katanungan dyan mamaya, pag-usapan po natin. So punta na po tayo ngayon sa general tips in prenatal care. Sabi ko nga po, one sure way of actually combating COVID during these times would be to make sure that our immune system is actually increased. No? So mahirap na nga po yung nag-iisip tayong lahat tungkol sa pandemya, pabababain pa po natin ang immune system natin. talaga naman pong double whammy po yun sa ating mga mommies at saka sa baby sa sinapupunan. So as I've said, proper nutrition is also essential. And what does proper nutrition mean? So well-balanced diet, no? Always remember, hindi naman po kailangan doble-doble yung kailangan kainin. We just need a well-balanced diet. So a pregnant woman needs to eat more calories to support the growth of her own body and of course the baby, no? So she needs to eat more calories and make sure that she has enough supply of folic acid, calcium, iron, vitamin A, and vitamin B complex, pati protein. So may additional po yan. Pag nakita niyo po yung weight gain, hindi naman po yan agad-agad. Karamihan po yung a big chunk of the growth and development of the baby occurs during the second trimester, but the vital organs, no, development occurs during the first trimester. So very, very important ang folic acid. Now, aside from that, we have to really avoid alcohol and other drugs. So as soon as you become, or even if you're just planning to get pregnant, we have to abstain from alcohol, smoking, yung mga recreational drugs, any agent that is not approved by your doctor. So of course, importante rin na when you check up, you also disclose to your healthcare provider kung ano-ano ang mga exposure ninyo. So even your occupation, ngayon kasi kung lahat tayo ay almost work from home, hopefully wala tayong mga exposure to toxic agents, okay? But noong unang panahon, no, pre-pandemic, kailangan po nating sabihin yung ating medical history sa ating mga providers, history sa pamilya natin ng genetic diseases, pati even mental disorders, kailangan din po nating i-disclose yun. Ano? Kung tayo ay gumagamit ng iba't ibang mga substances, okay, so you have to also disclose all of this para mabigyan po tayo ng tamang advice. Other things, so these substances po kahit maliit lang po yan, ano, they can actually harm or kill our developing baby and decrease the chances of our baby to live, no, and may cause long-term problems. So I will introduce here another term, yung tinatawag nating first 1,000 days. Kasi ang sinasabi po dito sa first 1,000 days, yung pong health, yung growth and development po ng baby natin pagka napanganak is actually intimately or complexly related to the nutritional status and health of the mother even before lumalaki, no? So importante po talaga na ang mommy ay pinangangalagaan na niyang sarili niyang katawan para optimal ang kondisyon niya kapag po siya ay nagbuntis at pagka pinanganak na po si baby. Okay, so we have to talk to your providers before you get, no? So even yung intake po ng mga over-the-counter drugs, importante pa rin po yun. So practical tips for labor and delivery. As I've said, be ready with your birth plan. Hanapin nyo na po yung mga lying-in centers, yung hospitals, kung saan kayong manganganak, kung sino pong magpapaanak sa inyo. Please make contingencies. As I have been discussing this with my patients, we're not sure kung silang magiging positive by the time na mag-labor sila. But then there is also the possibility or probability na ako po or ang inyong healthcare provider ang positive kapag kayo naman ay magle-labor. So saan po kayo pupunta kapag ang doktor nyo naman po ay naka-quarantine? Okay, so hindi po na day-to-day po ngayon ang paggawa ng mga plano. So you have to really plan this out well, discuss your options with your partner and the different caregivers in the community. One negative thing that this pandemic has brought upon all of us is that kung noon po buong barangay ang sumasama kay mami kapag manganganak na or kayang mag-alaga kay mami kapag nakapanganak na. Unfortunately, during these times, no, buti medyo out na po rin tayo sa ating ECQ, MECQ, napaka-isolating po ng experience natin na manganganak ka, ikaw lang at asawa mo ang nandun para mag-alaga kay baby. Parang hindi, ang hirap na yung buong community, buong family ay nandoon to help you with caring for your babies. So, mas madaling sabihin, save money, no? Prepare your paperwork, meaning yung PhilHealth ninyo, yung inyong pong mga sa SSS, okay? Kahit na medyo malayo pa, kung meron po kayong mga insurance, ayusin nyo na po habang maaga. And as I have promised, part of the general health and wellness of a woman would be an active lifestyle. So syempre babanggitin ko rin po yung benepisyo ng pag-e-exercise. Kasi hindi lang po ito physical, pati na rin po mental. Again, kung sa feeling po natin ay walang-wala na po tayong magagawa, at least for our own sakes, we can actually start moving. And these are all the different benefits, no, of exercise, whether you are in a pandemic or not. So it can improve cardiovascular fitness. So if you're afraid na kain ka ng kain dahil buntis ka, so pwede pa rin pong makatulong in controlling maternal weight gain, no? And hopefully, this will also reduce the risk for preeclampsia and gestational diabetes. So sabi rin po sa isang pag-aaral ni Clapp in 2008, exercising can also help, no, reduce subjective complaints of pregnancy such as back pain, swelling, no, and even mga fatigue and weakness. Of course, what is its influence during labor? It decreases the risk of operative or assisted deliveries. Pinapa-iksi po niya yung duration of labor, and hopefully malakas din po si baby paglabas. And hindi po matatawaran ang psychological effect, no, or well-being, no, effect on the well-being of the mommy of exercise. It can help improve mood, decrease stress, improve self-image, have an increase in endorphins, and endorphins are the feel-good hormones. So yan po yung exercises. What are the best exercises in pregnancy? You can have your walking, jogging. If you are active before you got pregnant, just continue doing it, and ask advice, no? Ask clearance from your healthcare provider kung pwede pa rin pong ituloy yung mga ginagawa. Okay, yun po, swimming pwede rin po. Kung gusto niyo mag-biking, no, ang bawal lang po ay yung may mga direct contact sport, kasi yung para tatamaan yung mga tiyan, and then meron po mga contraindications, pero konting-konti lang naman po yun. At yun ay kapag high-risk pregnancy ka po. So ipakilala ko lang po yung isang exercise regimen, but it's really more of a birth preparation plan, ano, yung sayuntis or sayaw ng buntis, para po matulungan po ang mga mommies na nandito ngayon sa webinar na to kung paano po i-increase ang enjoyment during labor and delivery. So this is sayuntis, and I would like to tell you what sayuntis is all about by showing you this video. Pwede na natin i-share yung video natin, yung first video. So ano nga ba yung sayuntis? Panoorin po natin to.
Ano ba ang sayuntis? Sa pangalan pa lamang, ito ay pinagsamang mga salita na sayaw at buntis. Ito ay isang koleksyon ng mga galaw at kilos na para sa mga nagbubuntis. Sa akdang sayuntis, nina Dr. Faye Cagayan, isang OB-GYN mula sa Philippine General Hospital, at Dr. Joy Santos, isang psychologist, ito ang mga pinagsama-samang galaw ng belly dancing, yoga, at iba pang exercises para makatulong sa mga nagbubuntis at sa kanilang panganganak. So bakit ginagawa ang sayuntis? Ano nga ba ang benefits ng sayuntis? Ang sayuntis ay isang uri ng exercise. Ito ay tumutulong para ma-improve ang inyong balance and coordination. Nakakatulong din ito sa pagkakaroon ng good posture. Ito rin ay isang paraan pamparelax ng mga muscles na laging nasa-stress and under tension. Nakakatulong din ito mag-relieve ng discomfort tulad ng low back pain, heartburn, and cramps. Ang sayuntis ay isang paraan upang mapadali ang delivery. Makatutulong ito sa pag-maintain ng target weight. During labor, ang sayuntis ay maaaring makatulong sa sakit mula sa contractions. At syempre, ang sayuntis ay isang paraan para i-celebrate ang inyong pregnancy. Ito at marami pang iba ang benefits ng sayuntis. Teka muna, bagaman ito ay isang low-impact na paraan ng pag-exercise, ang bawat tao ay magkakaiba. Kaya bago nyo simulan ang inyong sayuntis journey, ipagpaalam nyo muna sa inyong healthcare provider kung maaari kayong lumahok sa ganitong activities. Thank you for watching. Kung sa tingin nyo ay nakatulong ang video na ito sa inyo, please leave a like or reaction sa post na ito. And don't forget to leave our page a follow. If you want to see more videos like this, mag-subscribe sa aming YouTube channel at Scientist PH. Hanggang sa muli, paalam!
Yan po. Yan po yung Scientist in a nutshell. So it's actually an exercise regimen, but it also helps in bonding between mommies and their caregivers as well as with the doctors as well. And para po makita ninyo ang Scientist in practice, in real life, I will also show you this video. Pre-pandemic po, ganito po ang ginagawa namin ng mga pasyente ko sa PGH just to help them ease the labor of is the pain during labor. Show the video please. Pakita lang natin sa kanila. Ayan. Nagpaalam po ako sa pasyente ko na ipakita po yan. Actually, yung pasyente po dyan ay doktor din.
7, 8, circle. 1, 2, 3, 4, 5, 6, 7, 8. Hip lift. 2, 3,
And this is pre-pandemic po. Yan.
7, 8. Drop. 2,
During this time,
5, 6.
yes, during this time, I think ang patient po ay 6 to 7 centimeters. Medyo masakit na po pero nakangiti pa rin po siya. Naririnig niyo po yung tawanan, pati po ng mga may nurses po dyan, may mga OB residents. Ayan.
4, 5, 6. Lower. Lower. Up. 2, 3, 4, 5, 6, 7, 8. Hip lift.
Yan. So meron po tayong movements katulad ng hip circles, hip lift, no? Meron po tayong mga hampas sa lupa movements. So these are movements that can help position the baby. Yung po pelvic muscles po natin ay pinalalakas din po during hampas sa lupa movement. Okay? And then meron din po akong mga arm movements, kumpas ng amihan po para po palakasin yung arm muscles. Kapag nandyan na si baby, syempre magbubuhat po tayo kapag tayo ay nagpapasuso, syempre kailangan din po i-strengthen natin ang mga arm muscles natin. Yan. And then kapag po gusto na nating manganak, meron po tayong alab ng apoy or yung shimmy movements. That is ina-advise po kapag medyo parang natatagalan na kayo, gusto nyo na talagang manganak at term na rin naman kayo. Ayan, shake, shake, shake po para mabilis lumabas si baby. So those are all movements. Yan. So I also incorporate deep breathing exercises. No? So alam niyo naman, importante po ang breathing exercises ngayon during COVID. So inhale, exhale po for pain control during active labor. Those are all incorporated in Scientist movements. Pwede bang mag-Scientist kahit na pandemic? Aba, ang sagot ko po dyan ay pwedeng-pwede. panoorin nyo rin po itong susunod na clip at kahit po kalagitnaan ng pandemic ay nagpapag-Scientist.
I only asked you to show me a real good time. I never asked for the rainfall. At least I showed up. You showed me nothing at all. It's coming down on me. Harder like misery. It's coming down on me. I'm ready, rain on me. Drop, but at least
So pagkatapos po ng 1 oras, nanganak na po yung patient ko na yan. Wala po, ayan, ayan. Normal delivery, wala po siyang painless. So that's her second baby. And during the first delivery din po, I think we also did sa UPIS. Yeah. She was doing all these exercises even before she delivered. So ayan po yung mga poses and mga exercise movements mo po ng sa UPIS. Yan. So basically po, yeah. Thank you Faith. Thank you team for showing this video. So to cap po this talk, let me just give you a short summary. So before po lang mag-exercise, make sure lang po na nakapag-ask po kayo ng clearance sa inyong mga doktor kung pwede po kayong maggawa ng exercise. Not necessarily sa UPIS, you can do brisk walking, jogging, and everything. And then just listen to your body. Make sure that you drink a lot, hydrate, wear comfortable clothes, and again, listen to your body. So in summary po, I told you the general tips, the changes that the obstetric practices undergone during this pandemic, and hopefully yung mga tips po, lalong-lalo na po sa pagbabakuna sa mga buntis at para sa nagpapasuso po, ay inyo rin pong napakinggan. Maraming salamat po.
Galing-galing naman. Thank you so much, Dr. Faye, Doc Faye, for that very informative talk. Yung hindi niyo na matatanong kasi yung sister ni Doc Faye kasi kabatch namin yan, si Shilet. And she used to dance a lot during high school. Kayo rin po ba, Doc Faye, nung high school kayo mahilig din ba magsasayaw?
Ay, awa po ng Diyos kasi hindi po ako it girl nung high school. Sorry. Gustong-gusto ko pong sumama sa mga nagsasayaw ng high school. Unfortunately, ako po ay isa doon sa mga nerd. Pero mahilig din po ako magsayaw. Sa class namin sa 86, sorry, hindi ako yung mga napipili para magsayaw eh. Mga sinasalihan ko, mga contest ng spelling, ganyan.
Magaling naman.
Pero mahilig kami ni Shilet magsayaw, promise. Pati yung kuya namin, class 85, actually batch 85 of UPIS, we're all fond of dancing.
Okay. So ang daming mga useful information na kayo, Doc, no? Pero being a guy, I can't really relate to a lot of them. Tapos wala din akong anak, so wala akong wife na sinamahan ko through those stages. Pero we have some questions from our attendees today. So we will read them off one by one, starting with the question ni Black Mount 747. Mayroon pang alias. Ang question po niya, Doc, napapass on po ba ang immunity ng COVID vaccine sa breastfeeding or breast milk sa baby?
Ayun, thank you for that question ha, napakahalaga niyan ha. Nasa early stages pa lang po ang mga pag-aaral pero napapakita po na in some instances no, pag chinek po yung levels ng antibodies sa breast milk, pwede po talagang mapasa yung antibodies that the mother got from the vaccine, di ba? Nung buntis siya ay nabakunahan. So nakikita na po, mga early studies po ngayon, meron pong evidence na pwede pong maipasa sa breast milk ang vaccine, ay yung hindi vaccine, yung antibodies po na develop ni mommy. So makakabuti po talaga even for the babies.
Okay, very good. That's very important for us to know at least during these times. Next question po, any suggestion po for lactating mom na nagka-COVID though mild lang yung symptoms?
So yun po, parang ang question na lang po ng COVID ngayon, it's not a matter of kung magkakaroon ka or hindi eh. Ang question ngayon sa COVID, kung kailan ka magkakaroon, di ba? Parang ilag ka ng ilag pero eventually we thought we were past that last December, pero with the experiences that we're having now, parang apparently sooner or later, di ba? But so, the same advice will hold for all people na nagka-COVID. Continue increasing your immune system, boosting your immune system with intake of vitamins, no? Vitamins, yung pong ating mga para sa mga vitamin C, zinc, no? Yung ascorbic acid po natin, eat nutritious food, sleep. Sleep is a vital component of increasing our immune system. And unfortunately, for lactating mommies, yun po ang kulang, di ba? Kapag tayo ay nagpapasuso at bagong panganak, parang kulang na kulang po tayo sa tamang tulog. So, tuloy lang po ang pag-inom ng ating mga vitamins. Kapag po natutulog si baby, nagpapahinga, isabay na rin po natin ng tulog. Be prayerful, let us be hopeful, kasi po kapag positive po ang thoughts natin, hopefully mag-translate po yon into a good immune system and body. So whether or not you had COVID or not, the same rules will apply for mommies who had COVID, even for people here na hindi naman mommies. Deep breathing exercises, go outdoors if you can, expose yourself to the sunshine, kasi sunshine, vitamin D will also help. Lots of fresh air as much as possible. And ano lang po, hinay-hinay, kung bagong kaka-recover lang po from COVID, huwag nyo pong mamadaliin ang recovery, no? We have what you call your long haul COVID. Kahit mild COVID lang, ang dami pa rin parang mga residual symptoms even a few months after. So don't assume that, konting pasensya lang po talaga. Bagong sakit, inaalam pa po natin, inaaral pa po natin ito. So ano lang po, tuloy-tuloy lang po ang pag-alam, no? So even yung pagkuha ng tabang information about COVID can actually help. So take your vitamins, sunshine, optimistic demeanor. Yun lang po yung masasabi ko. And continue practicing the minimum public health precautions. So even if you are already vaccinated, please wear a mask. Huwag po magkukumpol. Yung face shield kahit pa paano, may hope sa akin, I think may tulong pa rin. Okay, proper cough etiquette. At saka yung iwas po muna sa maraming tao. Nakakasira ng ulo pero ganun po talaga.
Sa akin yata, mas umiiwas na yung mga tao automatic. So hindi ko kailangan iwasan na sila. Sila na yung kusang namalaw. Thank you for, that was a question from Carlene Bumatay, by the way. The next question that we have is from Mary Grace Megrino. Meron po bang specific brand ng vaccine for pregnant or lactating mothers?
All brands are considered safe except po ang Sputnik mismo nagsabi na hindi sila gagamitin for pregnancy. Galing na po mismo sa manufacturer na hindi sila pwede. But the vaccines that we have now, no, the mRNA based vaccines, they're good for pregnant women.
Oh, all right. And the next question is from Mapes Quinones. Kamusta po ang pregnancy or birth statistics throughout the pandemic? Nag-increase po ba ang dami ng nagbubuntis? At mga interesting question. Mga
yes.
Sa bahay lang, mga tao.
medyo yes. Hindi ko pa nakikita actually yung statistics, but usually itong mga burr months in usual times talaga namang panahon ng tumataas talaga ang birth statistics, but informally I think we have seen a rise in a lot of pregnancies. Unfortunately, in a subset of teen pregnancies, doon yata medyo tumaas. So medyo yun lang, kailangan pa rin makita yung actual numbers, but we're seeing an increase in births, but we don't know yet the outcomes of these pregnancies as yet.
At saka yan po ba ay may ibang trend po ba na caused by the pandemic, or talaga lang during the burr months ay talaga
burr months talaga ay kasi wala pa naman yung actual na datos natin, pero doon sa hindi man peak season pero dumami talaga dumami siguro, especially last year dahil wala namang ibang ginagawa yung mga tao
first time na
second half ng 2020. So yun.
Ito, Doc, medyo hindi pandemic related, and I'm not sure if you're gonna be able to answer this. Yung po bang November po ba ay madami talagang births na nangyayari?
Burr months. Ang November ay kasali pa rin sa
Burmans
Burr.
in general.
Oo, in general. Kasi noong pre-pandemic, yan, di ba? Tayo mga Pilipino gustong-gustong wedding. Hindi tayo June weddings, hindi tayo June brides.
December
If you're
time.
going to look, it's December kasi nga umuwi for reunions, lalo na yung mga OFW. So
Ayun.
December hanggang
Ang
February,
sarap.
right? Look, December hanggang February and then count 9 months. So ilan yon? So birth talaga yung marami.
Okay.
So December to September, tapos December to February, that will translate into September to November.
Right. Ang nasa isip ko naman po kasi yung Feb. Dahil Valentine's Day. Alam niyo naman yan.
Well, kasi malamig. Yun lang yung mga yon. Yung part na yan, December hanggang February, malamig. Parang peak yan ng mga nagpapakasal sa atin.
So that makes, parang puts more logic into the mga naiisip natin. So I think that's all the questions that we have for now, Doc Faye, pero stay with us dahil you're still gonna join us later on sa second segment natin for more Q&As. For those people who forgot their question or only thought of their question later in the show, we're gonna open up the floor for their questions too later on. All right. So, si Faith, samahan mo nga ulit ako dito.
Hello again.
What's next for us?
Meron kasing mga nagtatanong, I think, dahil naka-raise yung hands nila sa Zoom ngayon, please make sure to click more, the 3 dots, then click Q&A, then type in your question. So, mamaya babalikan tayo ni Doc Faye para sagutin niya ang mga tanong ninyo. And before we go to the next part of our webinar, parang medyo tahimik ulit yung chat natin, no? Dwayne?
Yeah.
Siguro magtanong tayo sa ating mga attendees ngayon, kung nandyan pa talaga sila. Kayo ba ay vaccinated na or hindi pa? Type in your answer now. Kayo ba, Sir Dwayne, vaccinated na po ba kayo?
Ako hindi pa.
Oh.
Hindi pa ako.
Well,
Yan,
pwede na tayo magpa-register sa ating local government units. Ako, fully vaccinated, 1 shot only. Dahil Janssen ang ating vaccine. Ayan,
so only half vaccinated, not fully vaccinated, diba?
Half vaccinated. Okay, sabi nila 1 dose pa lang daw. Wow, okay. Buti na lang hindi ka daw pregnant, Sir Dwayne. Thank you so much for being vaccinated para magkaroon na tayo ng herd immunity.
Nag-iingat ako kaya hindi ako pregnant.
Okay. Other than that, alam niyo po ba, konti lang na trivia. Ngayong September actually, almost 80%, 90%, 80% na ang fully vaccinated sa Metro Manila. At okay, I will check my facts. Pero yun yung huli ko narinig.
That's good news.
That's really good news. Well, for the next part of our webinar, ay puntahan natin ano nga ba ang meron sa batch 1996. Dahil nga ito ay kanilang webinar, ang Magbidahan sa Kalusugan ng Pamilya Ngayong Pandemya. Meron silang pledge to give back to their alma mater. At paano nga ba nila yan ginawa? To see that, let's watch this video. those are the latest activities, projects, and happenings from Batch 96. For their 25th year, their main focus is to give back to their alma mater by raising funds to help UPIS students with their online learning. So you can be part of this too, no? You may donate or buy through the UPIS The Best SNS or upisthebest.com. And now, meron tayong announcement of raffle winners for our first batch. Sir Dwayne, ano bang mapapanalunan nila?
As far as I know, these are gonna be gift packs from Cetaphil, our sponsor for this event. I'm not sure though what the contents are. Yan pala, sorry. Yes, Cetaphil Sun is gonna be one of the prizes. So we will read out 10 names of participants that we drew from all those who registered, who are also with us right now kasi meron mga nag-register pero hindi actually umattend ngayon. So these people will receive a product that protects your skin from sun damage. That's Cetaphil Sun. Meron ako niyan. I got it. I won it from a previous event that we had. Very good sa ano. And it's also, sa pagkaalam ko, this is highly waterproof. So it's good for the beach.
Yeah. Ako, bigyan tayo ng Cetaphil from the last event. May I help you read out the winners for this one?
Yes, please.
Okay, all ears tayo dapat. So our first winner is Agatha Christie Villanueva. Kindly message us your details. And then next, Athena Marie Villanueva. After that it's just Tichua. And after is Milagros A. Pagila. Then Marjo Crueldad, Maria Rose Ginetlin, Jemeline Piol, Eduardo Hermosa, Candy Camba, and Angelica Yapo. Basahin ko ulit ha. Agatha Villanueva, Athena Marie Villanueva, Tichua Milagros Pagila, Marjo Crueldad, Maria Rose Ginetlin, Jemeline Piol, Eduardo Hermosa, Candy Camba, at Angelica Yapo. You all have won Cetaphil Sun. Congratulations.
Ayan. So again, if you heard your name being mentioned by Faith, please chat with the panelists. Wag po dun sa chat, sa message to everyone. Dun sa drop down, choose host and panelist. Send us your name, number, email, and shipping address so that we can know that you are still watching our webinar and here with us right now. And yeah, so you have time to do that until the after the second Q&A, dun sa second portion ng talk natin.
Well, if you missed what we are giving out as raffle prizes, let's watch this video.
Is your cleanser doing enough for your sensitive skin? Give your skin complete care with dermatologist's most prescribed Cetaphil Gentle Skin Cleanser. It defends against 5 signs of skin sensitivity and actively hydrates as it cleanses. Don't settle for less. Give your sensitive skin everything it needs.
Thank you again, Cetaphil, for sponsoring this event. And now let's go to our mini myth buster poll. Before we introduce our second speaker, we have some questions for you. So a prompt will pop up your screens, and we would like to hear what your answers are to these questions or statements. Are you ready? If you're ready, thumbs up na tayo dyan sa ating chat box. Are you ready? Wala pang thumbs up. Meron na ba? Ready na ba tayo o tinitignan nyo pa rin yung ating list of winners? Ayan, ready na pala. So can we now pop up our poll, please? Nakikita nyo na pa sa... Okay, please answer those. So first question, who among you have close encounters with adolescents or teens as students, relatives, patients, etc.? Meron, in Tagalog, meron na ba tayong mga kakilala na teens or adolescents? Siguro naman meron. So ako, sasagot ko yes.
Na-try kong sumagot dun sa poll, hindi pala ako kasali.
Ay, ako rin para. Host and panelists cannot vote. Okay. Number 2, who among you are fully comfortable with teens and can say that you fully understand how they think, feel, and act? So, number 1, meron ka bang kakilala? Number 2, komportable ka bang makipag-usap sa kanya or komportable ka bang makipag-interact sa kanya? Do you understand them? Can you understand how they feel? Ano nararamdaman nila? Paano sila mag-isip? At paano sila kumilos? Answer, yes, maybe, or no. Go.
I'm gonna be very interested in sa results ng number 2 kung how many of our attendees are confident, being parents, they understand fully how their teenage children think, feel, and act.
Yeah. Can we now please show our answers? Meron na ba tayong enough answers? Can we show our poll now? Okay. Ayun. Meron. Nagsabi ng yes. 93% ay yes. May kakilala tayong teens. At 3% sabi no. Walang tayong kilalang teens. Wala po tayong kakilalang teens. I think meron yan. Hindi lang po natin agad naisip. And number 2.
Close encounters kasi yung sa question. So maybe
close encounters.
Nakakahalubilo.
Tama. Sorry, that's my that's my fault. Mali yung aking pagkakaintindi. Close encounters pala talaga dapat. Number 2 naman, ang sumagot ng komportable sila na maintindihan ang teenagers ay 53% or just half or more than half ang nagsabi ng yes. Good for you. And maybe ay 33%. Ang no naman ay 15%. Ngayon, bakit nga ba tinanong sa atin ito, no? Malalaman natin yan maya-maya lang. But let me introduce to you first kung sino ba yung magtatackle ng questions na yan. At sino ba talaga yung nagtanong yan sa inyo? Well, he is our second speaker. Our second speaker is a doctor. Dr. Jimmy Dumlao II. And actually, he is he is the consultant of Department of Pediatrics Medical Center Manila and Diliman Doctors Hospital. He did his residency training at Department of Pediatrics, UPPGH. Also, he is currently working on his Master in Health Profession Education in UP Manila. At present, Dr. Dumlao is the training officer of the Manila Med Department of Pediatrics, and he heads Manila Med's Gender Diversity Center. Of all this, Dr. Dumlao is most proud of his being a member of the UPIS batch 1996. Let's all welcome Dr. Jimmy Dumlao. Dr. Jimmy?
Hello, good afternoon. Good afternoon, Faith. Batchmate
afternoon,
Dwayne, lahat ng
Hi, Jimmy.
batchmates ko in the group. Ma'am Faye, good afternoon po. Good afternoon, everyone.
Sir, you may now have your discussion. Bakit niyo nga po ba naitanong sa amin itong mga polls about the teens and our interactions with them?
Yes, actually natuwa ako dun sa sagot ng mga ng audience natin regarding lalo na dun sa second question because sabi mo nga, good for you. But because for most people that I get to encounter, they have apprehensions, they have reservations with regards to how to deal with teens. Kasi iba ang takbo ng pag-iisip nila minsan, and hirap minsan tayo mga adults to deal with them. And actually, that's precisely one of the reasons why the field of adolescent medicine was born in pediatrics, out of recognition that uh, the teens have a different subset, a totally different set of beings altogether. And until we as adults yung pumunta tayo doon sa level nila, no? And hanapin ang wavelength nila, there will be a mismatch with regards to communication. No? So, natutuwa ako na ano yun kanina, 53% yung nagsabi na they are comfortable. No? That's good to hear. But there's opportunity to work on the remaining 47, 48% of the audience. No? So let me share my screen. Hold on.
Habang siniset up ni Dr. Jim yung kanyang screen, this talk will be about the mental health of our youth during the pandemic, right, Dr. Jim? Dahil ang dami na changes na nangyayari sa katawan ng isang teenager, di ba? May hormonal changes, yung bigla ka na lang, dati wala akong buhok dun bakit may buhok na ngayon? Or yung mental changes din, meron ka rin mga pagbabago sa iyong mindsets. Who are you na ba kapag ka-high school ka na or pa-college ka, ikaw pa rin ba yung dating ikaw? So, these are some questions that we have in our minds, and Dr. Jimmy would like to share his insights about this. Are you ready, Dr. Jimmy?
Hold on, apparently hindi ko ma-share yung mismong video eh.
Okay. It's okay, sir. For our panelists, please help Dr. Jimmy set up his video sana. Pabalikin muna natin si Sir Dwayne kaya. Sir Dwayne, dyan ka po ba?
Yes, sorry.
Ayun. Sir Dwayne, ano ba yung mga sa tingin mo challenges ng teens ngayon? Given ang dami na pinagdadaanan.
No. Well, tulad na yung sabi ko kanina, wala naman kasi akong anak, so I can't, I couldn't relate to the pregnancy part of our discussion. No? And then dito sa teens naman, I can only relate through my own personal experience being a teen back several decades ago. So, pero I think it's very common naman for teens na parang in any generation, I think everyone went through that phase of no one understands me na mindset, di ba? Nung teenager ka. So I think that's one of the things that will be discussed or will be touched on by Jimmy, Dr. Jimmy in his talk. Hindi ako sanay tawagan si Jimmy lang Doc Jimmy. We were very close in high school and even in college. Pero yun nga, just like one of the questions that Jimmy had in his poll, di ba? Yung how many of our attendees fully understand the teenagers or the adolescents in their life. So parang yung 53% na nagsabi ng yes, I would say that they're very admirable because they have, diba? Yes, and very lucky too, because that just means that they have been able to bridge the gap or bridge the communication gap between the parent and the child that the parent and the adolescent child, I should say.
Yeah, I agree with you, Sir Dwayne. Although we can say a lot about, sure that our guest speaker has even deeper insights about this. No?
Yes.
So, are you now ready, Dr. Jimmy?
Tingin ko kahit na medyo madami yung sinabi ko, mas masustansya yung maibigay sa atin ni Jimmy being an expert on
Are you ready, sir?
this topic.
Are you ready, sir? Dr. Jimmy?
Ila-live na lang yata ni Jim.
Oo, ayan. Ready na po? Tulad nga ng mga sinasabi namin sa webinars or sa mga online meetings namin, galawin niyo po ang baso kung nandiyan na po kayo, Sir Jimmy. At kayo rin mga participants, galawin niyo rin po ang baso. Mag-type in na po kayo ng questions for sure kahit hindi pa nagsistart tong second session natin at dami na nating question.
Yeah, I think the video is ready to play now. So let's go ahead and watch it.
Okay, let's watch it.
Good afternoon. I am Dr. Jimmy Dumlao II, and I am a member of the UP Integrated School batch of 1996. As part of our activities in celebration of our Silver Jubilee, my classmates have prepared and organized a series of webinars, with today's session being the second installment sa Magbidahan sa Kalusugan Part 2. 25 years ago, in 1996, I left the halls of UPIS, which served as my second home for 11 years since I entered in kindergarten in 1985. In UPIS, I spent most of my most memorable formative years, a good portion of which was my adolescence, my teenage years. Now, going full circle, I go back home to UPIS today to speak about exactly that, about understanding teens, now in the context of the ongoing pandemic. I am a pediatrician with subspecialty training in adolescent medicine, meaning I take care of pediatric patients, but with special interest in teens or adolescents. Even before the pandemic, it has always been a challenge for us adults to understand the teens. On a developmental point of view, they have a very unique perspective in life, which often becomes a source of stress and conflict between teens and us adults. As such, there really has been a strong need for us adults to reach out and exert extra effort to bridge this gap. As it is, going through adolescence causes stress on an individual, with all the so many rapid changes happening in a teen's life. The ongoing pandemic has made our adolescents cooped up in their homes well against their will exactly 18 months and 2 days today, deprived of the usual activities and experiences crucial in the unique development of our teens. Now more than ever, our teens need our support. And we can only give this support if we understand them. Our roadmap to help all of you be put in proper perspective will be as follows. We will discuss what is normal in adolescent growth and development. Then we will talk about the current situation of the teens vis-a-vis the pandemic, and then we will explore means by which we can help. This will be our outline. Adolescence is the stage of rapid growth on the various aspects of life, how they look like, how they relate with others, how they think, and how they feel. It is in this stage that the person experiences the last growth spurt, where the individual will gain 20% of the final adult height and 50% of final adult weight. Non-ideal gains during this stage, therefore, will mean non-ideal physical makeup in adulthood, which in turn can have various implications to health, in particular, non-communicable diseases. Physical growth and development are strongly affected by three forces: nutrition, physical activity, and sleep. In a study made by UNICEF involving almost 9,013 to 29-year-old individuals, 1 in 2 believes that the COVID-19 crisis made it more difficult to access healthy food. The results showed that respondents saw as barriers to access to healthy food, having less money to buy, and fear of contracting the virus. During the COVID-19 crisis, there has also been an increase in consumption of sugary drinks, snacks and sweets, and fast food and convenience products, and a significant decrease in consumption of fruits and vegetables and water. Around 1 in 4, or 23% of the participants, said they saw more ads for unhealthy products in the media during the pandemic. During this pandemic, we have seen the overproliferation of various apps to make food accessible. Indeed, it made life so much simpler. Unfortunately, it also made access to unhealthy food choices easier. To add to the app phenomenon is the fact that most family members are now cooped up at home. So before, the limiting factor for adolescents' access to fast food is money, where most have limited baons or allowance. Now, whenever teens order via apps, they also get the orders of their parents, their favorite fast food or favorite milk tea, and parents end up paying the bill. In the same manner, when adults order, the children are also invited and are involved. Access to unhealthy food options have therefore been facilitated. According to the National Nutrition Survey of 2019, a significant number of our teens are obese and overweight. I haven't gotten across latest local studies, but we can safely assume this number has now ballooned with the discussed easier access to junk food and the inactivity brought about by this pandemic. Malnutrition is a double burden. On the other side of the spectrum is undernutrition, being experienced by individuals from families whose breadwinners have lost their jobs. And this is a lot. Now, pre-pandemic in 2018-2019, we already have a significant number of stunted and wasted adolescents. With the increase of unemployment and underemployment rates, we again safely assume this number to have ballooned. The restrictions of the various levels and letters of our community quarantines have limited the physical activity of our teens, in some cases perhaps down to zero. In a study made in China among children and adolescents, inactivity was reported by 21% of respondents pre-pandemic, which sharply increased to 65% during the pandemic. 60% reported sufficient activity, which fell to 17% during the pandemic. Physical activity was replaced by screen time, where those reporting leisure screen time of more than 2 hours per week rose from 7.3 to 30.9. That's by more than 4 times during the pandemic. According to the World Health Organization, a person is said to be physically inactive if the individual does less than 75 minutes of moderate to vigorous intensity physical activity in a week. Available data show that in 2019, Filipino teens 10 to 17 years of age have been physically inactive. That's around 77% of male Filipino adolescents and 87.8% of female Filipino adolescents. Now, with all the stay-at-home orders, every so often closure of gyms and parks, I won't be surprised with numbers reaching upper 90s in both sexes. Sleep is critical to physical health and effective functioning of the immune system. It's also a key promoter of emotional wellness and mental health, helping to beat back stress, depression, and anxiety. Children 6 to 12 years of age should sleep 9 to 12 hours per day, while teenagers 13 to 18 years of age should sleep 8 to 10 hours per day to promote optimal health. Sleeping the number of recommended hours on a regular basis is associated with better health outcomes, including improved attention, behavior, learning, memory, emotional regulation, quality of life, and mental and physical health. Regularly sleeping fewer than the number of recommended hours is associated with attention, behavior, and learning problems. Insufficient sleep also increases the risk of accidents, injuries, hypertension, obesity, diabetes, and depression. Insufficient sleep in teenagers is associated with increased risk of self-harm, suicidal thoughts, and suicide attempts. Coronasomnia is a new term that refers to sleep problems related to the pandemic. With increased stress and anxiety, there is a definite impact on our sleep and mental health. This phenomenon should not be much of a surprise, however, given the new behavior of people during the pandemic. A recent study indicated that among 2,067 adults surveyed in May 2020, 46% were letting their children go to bed later, 51% reported letting their children wake up later, and 49% were allowing their children more screen time. Now to our adolescents' cognitive development. The teen brain is a work in progress. It is a gem still in the process of being polished. As such, we need to manage our expectations. When I say this, I do not mean it with condescension, and instead with much openness and understanding. By understanding them, we won't be judgmental towards our adolescents. The amygdala, that is responsible for immediate reactions, including fear and aggressive behavior, develops very early. However, the prefrontal cortex, the area of the brain that controls reasoning and helps us think before we act, develop later. This part of the brain is still changing and maturing well into adulthood. The rational part of a teen's brain isn't fully developed and won't be until about age 25. The impulsivity and high levels of emotions, together with the repercussions and the lessons they learn from these experiences, are crucial in the adolescent's development into adulthood. Now, by absolutely denying the adolescents any opportunity to be a bit too irrational, a bit too emotional, or a bit too impulsive during this pandemic, then there can be repercussions to the teen's development into adulthood. By denying them opportunities to fall, how will they learn to stand up into healthy, psychologically, socially, and emotionally stable adults? Teens are hardwired and pre-programmed to really want to be with peers more than with the family. This is transient but very important in development because it is at this stage that nature kicks in and makes these teens want to launch away from their nests. On an evolutionary point of view, this is crucial in the perpetuation of the species. Adolescents are in a developmental stage of growth, discovering and defining their role among peers and in the community, and forming their values and identity within that context. They have 4 core developmental tasks, which they should negotiate and figure out to allow them to healthily transition into adulthood. They should develop a sense of independence. They should form and be comfortable with their body image. They should nurture their relationship with peers. And they should have a strong sense of self-identity. The pandemic has disrupted peer interactions that are a critical developmental task during adolescence, leaving adolescents at a higher risk for anxiety and depression because of social isolation and reliance on technology for social interactions. UNICEF did an assessment of over 8,000 adolescents, and among the participants, 27% reported feeling anxiety and 15% feeling depression in the last 7 days. The pandemic has affected the daily life of young people as 46% have less motivation to do activities they usually enjoyed, with 36% feeling less motivated to do regular chores. A situation that generates deep concern and is a call to health authorities is that 73% have felt the need to ask for help concerning their physical and mental well-being, but despite this, 40% did not ask help. Now, despite facing great difficulties, many adolescents and young people have found different ways to face new challenges and cope with their emotions. Thousands shared their formula. One helped in community kitchens to distract his mind away from the pandemic. Another adolescent said her formula is to read and write and to distract herself by drawing and watching series. However, she went on saying that the COVID-19 has changed her a lot to a point that she no longer recognizes herself. Mental health related concerns have been on the rise even pre-pandemic, and the advent of the global menace has sharply worsened the situation. Unfortunately, in the local setting here in the Philippines, there seems to be a mismatch with the supply and demand for mental health services. According to the World Health Organization Special Initiative for Mental Health, we only have 548 psychiatrists practicing in the country, or approximately zero point 0.5 psychiatrists per 100,000 Filipinos. 516 psychiatric nurses, or zero point 0.5 per 100,000, and 133 psychologists, or zero point 0.1 per 100,000 population working in institutions in the country. Most mental health services are offered by private providers, as the public sector has limited specialist mental health facilities. There are only 4 mental hospitals, 46 psychiatric inpatient units, and 29 outpatient mental health facilities for the whole country. In addition, there are an unknown number of people with mental health conditions in institutions run by the Department of Social Welfare and Development. In an article from Lancet Child and Adolescent Health, in the Philippine General Hospital, 17% of consultations with adolescents in 2019 were related to mental health concerns, where most of which are anxiety and depression. According to Dr. Emma Llanto, the Division Chief of Adolescent Medicine and my mentor during fellowship training, in 2020, that proportion climbed to 27%. These patients cite pressures from online learning, as well as feeling overwhelmed and missing the opportunity to socialize and be physically active. Although services have remained available, with some hospitals and clinics offering remote telehealth consultations, access is still not that universal. In PGH in 2020, the 950 teleconsultations accounted for just 25% of the pre-pandemic face-to-face consults. So how can we help? Now, while it is true that there are very few mental health specialists, all of us here in this webinar, stakeholders in the care for our youth, teachers, guidance counselors, doctors in the audience, nurses, parents, people with teenage relatives, we must all learn to be comfortable talking to our teens. Even if you may not be an expert in the field of adolescent health, that doesn't mean that every teen patient is readily bumped off to the nearest specialist. We all should be comfortable talking to our teens and to ask basic questions. In our encounters with our youth, we must be sensitive and astute in recognizing danger signs. We must also normalize the need to watch out for each other's mental health and well-being. For doctors in the audience, almost everyone will inevitably come across teen patients. Same in the case of nurses. Since teens have very low health-seeking behavior, we must all, regardless of specialty, make questions about mental health part of our checkups. Or for the part of teachers and guidance counselors, make questions about mental health part of your homeroom or counseling sessions. Mangumusta. Now, if we get to pick up red flags, then assess the need for initial counseling. We all can do that, especially the guidance counselors and teachers. Then, if needed, we can make a referral to adolescent medicine pediatricians or doctors from psychiatry, in particular, those in child and adolescent psychiatry. The point is, there is a need for us to recognize need for help, to know how to give initial response, and know when to refer and to whom. Now, back to the physical development. How can we help? Examine the major forces affecting physical development: nutrition, physical activity, and sleep. While a healthy diet and dietary supplements cannot prevent COVID-19, eating right can support the immune system. Teens benefit from a balanced diet rich in vitamins and minerals, The FNRI has suggested the Pinggan Pinoy for teens as seen in the picture. Eating healthy does not have to be boring. If your teen likes to cook, include them in meal planning and preparation, and this will be a great way to connect with them. Ask your teen what they like to eat and see if there is a way to make their favorite food items more healthy. With schools and recreation centers closed, your teen may no longer have access to the same sports teams or opportunities to exercise that they used to. Instead of focusing on all the restrictions on exercise, it might help to think of the pandemic as an opportunity for movement. When allowed, get outside. There are plenty of ways to engage in safe, socially distanced forms of exercise. Teens may be able to safely take a walk or ride a bike. They just have to make sure to wear a mask and stay 2 meters or 6 feet apart. Encourage your teens to take a walk with you. As a bonus, you can use that time to connect with your teen. Then you can play family-based games where family activities are another way for you and your teen to exercise and connect. For example, you could play a movement-based game like charades or make a family competition to see who gets the most steps in a day. And then use technology to find ways to move. You can ask your teen what they enjoy doing for movement and see if there are videos that support that type of exercise. If your teen likes to dance, you or your teen could look for videos that teach dance. Many gyms and fitness instructors are sharing workouts on social media for little to no cost that will help your family get moving. Just as physical hygiene, especially important now, it is essential teens practice good sleep hygiene. Establishing good sleep habits can help your teen sleep longer and better at night. You have to set a sleep schedule. Research shows that going to bed earlier helps teens have a better sleep quality. To ensure good quality sleep, have your teen set a schedule for regular bedtimes. Then create an effective sleep environment by putting up curtains or wearing a sleep mask. Teens can benefit from doing their schoolwork outside of their bedrooms. Doing work in their bedrooms may cause teens to associate their bedrooms with studying and being awake instead of sleeping. Then, limit electronic device use. They have to turn off devices 1 hour before bed to help teens get better quality of sleep. The blue light coming from screens block the natural production of melatonin, a hormone which induces sleeping. Then they have to spend quality time with family. The stress caused by the pandemic may increase anxiety in teens, which may affect their ability to sleep soundly. Spending quality time with family during the day can help teens feel closer or more connected with their families. Feeling connected and safe with their family may help teens feel more secure. In turn, feeling secure can make it easier for them to sleep at night. Try setting up regular family game nights and do everything to ensure that you always eat your meals together. Then, let go of emotions before going to bed. Too many people bring their problems to bed, and these emotions make it harder to fall asleep. And more likely, they'll wake up during the night to worry or problem solve. Dealing with emotions and thinking them through is helpful, but encourage your teens to do this somewhere other than in bed, because the bed should only be a place of peace, comfort, and rest. Technology doesn't always have to be a bane in child and adolescent development. As a form of living with the restrictions of the community quarantines, allow our teens to socialize and interact with other safe online platforms. We now have Zoom parties. And there is a new concept which I got from a patient recently, the online tambayan, where the teen can join live a virtual room, where the teen can suggest music that will be streamed in the room or a YouTube video to be streamed into the room, where all the members can listen simultaneously to the same music or simultaneously watch the same video. Members can chat with each other. This gives them a feel of nakatambay with their barkada even without having to be physically with each other. For health maintenance, telemedicine must be encouraged. Telemedicine can now deliver services for medical concerns and even counseling needs. Stress management is important, and the first step in stress management is recognizing which factors you can control and which factors you cannot. This is crucial because it is pointless stressing over things which you do not have control over. While teens cannot snap away the pandemic, they can help curbing down the numbers by adhering to minimum health standards all the time. Adult household members must be vaccinated against the virus, and the moment adolescents are allowed to, they must get their shots too. In the meantime, we must make sure that teens have updated vaccines. Catch up if needed. Time management is a twin sibling of stress management. Encourage our teens to have routines. There should be specified time for every activity. There should be fixed time for waking up, for eating meals, for going to the shower, for doing schoolwork, for chores, for play and recreation, and fixed time for sleep. Anyway, this was how life was pre-pandemic. These fixed activities will serve as time anchors, which will allow the teens to go by each day with familiarity and therefore less stress. Take-home points from this talk include COVID-19 has a significant effect on the growth and development of our teens physically, cognitively, and on a psychosocial level. Adults can serve as primary caregivers for adolescents, where adults must recognize red flags in disturbances in normal growth and development. Mental health concerns are prevalent, especially during the pandemic. Primary healthcare providers should be able to give initial response in mental health issues and must know when to refer. We must all be comfortable talking to our teens. Finally, all adults can turn this pandemic as an opportunity for guidance and care for our teens. We now go back to the objectives set at the beginning of the talk, and we have successfully reached these goals. These are my references. In behalf of all my classmates in UPIS batch of 1996, thank you very much for your attention. I hope you all learned something new and something useful for your encounters with our teens. And let us all be heroes in our own right by saving the world one teen at a time. Thank you.
Thank you so much, Dr. Jim, for that presentation. Nung naririnig ko yung presentation, I was thinking, parang hindi lang yung teens yung may kailangan ngayon yan, kundi tayong lahat because nagulo yung schedule natin when we got in this pandemic, tapos nagkaroon ng lockdowns. And we know you have questions for Dr. Jimmy din. Tanggap namin yan. Tanggap namin through the question and answer tab. Pero before that, pagpahingahin muna natin si Dr. Jimmy. No? And we would like to announce the second batch of raffle winners muna, who will receive the Cetaphil cleanser and moisturizer pack. So here are the winners. Cecilia Ortiz Luis, how do I say this? Deus Bakut, Geraldine Tizon, Josephine Lamontan, Leslie Tolentino, May Cese, Mary Grace Mecrino, Mapes Quinones, Paul Anthony Buer, and Rowena Laterno. Another rundown of the second batch winners: Cecilia Ortiz Luis, Deus Baco, Geraldine Tizon, Josephine Lamotan, Leslie Tolentino, May Cese, Mary Grace Mecrino, Mapes Quinones, Paul Anthony Buer, Rowena Laterno. And what you will get is the Cetaphil cleanser and moisturizer pack. Congratulations! Don't forget to chat us your name, number, email, and address so we know that you are still watching our webinar. We are giving you the time to acknowledge until after the second question and answer. No, if someone acknowledge again, we will give it to our other participants. Now, may we call back Dr. Jimmy Dumlao for our question and answer. Hi, Doc Jimmy.
Hi, good afternoon.
Good afternoon, Doc Jimmy. Puntahan na po natin yung mga questions natin dito at medyo madami-dami. First
Okay.
question natin. How can a teenager develop anxiety during the pandemic? What triggers this?
Okay. Most adults would think, paano magiging mahirap yung buhay ng mga teenagers? Nasa loob lang naman sila ng bahay. I heard one parent.
Wala naman sila work.
I had one parent ng pasyente ko nagreklamo sa akin, paano magiging mahirap ang buhay nila na yung school sa bahay, no? Yung online classes nila. Hindi na nga sila mapupunta sa traffic, hindi sila nabubuli sa school. Hindi na nila kailangan problemahin na mag-conform dun sa itsura ng mga kaklase nila kasi nandun lang sila sa loob ng bahay. But then, if you get to talk to a teenager, you will realize how difficult it is. Prior to the pandemic, it is very easy to compartmentalize our lives. Come 7 o'clock, when it's already time for you to leave the house para pumasok ng eskwelahan, compartmentalize, leave everything, lahat ng stressors ng bahay, iiwan mo sa bahay. So hindi ka na mauutusan ng nanay mo, hindi ka na mapapagalitan ng tatay mo, hindi ka na aawayin ng kapatid mo. Iwan mo silang lahat kasi pupunta ka na sa school. Pagdating mo sa school, ang poproblemahin mo na lang yung bullies siguro sa school, yung stress ng klase, ng extracurricular na mga requirements. Pagdating ng uwian, compartmentalize again. Iwan mo lahat ng nasa problema ng eskwela and then haharapin mo na lang yung problema ng bahay. One problem at a time. Right now, during the pandemic, nawala lahat ng borders. Sabay-sabay, simultaneous lahat ng stressors. And it's very overwhelming for everyone, especially for the teens. No? Yung isa kong pasyente, ang sabi sa akin, Doc, yung teacher ko sa subject na ganito, magpo-post ng kung anong requirement, magbi-beep yung yung Viber group. Kasalukuyan pa nilang nagkaklase dun sa kabila pang teacher. Magte-text si teacher A habang nagle-lesson si teacher B, kasabay nung isa ding requirement na sasabihin ni teacher C. So sabay-sabay. Tapos habang nagkaklase siya, lahat nung nakaiwan na naka-allot sa kanya na hugasin ng pinggan, nandyan pa din. Siya pa rin ang maghuhugas ng pinggan. Kasi para sa pananaw ng pamilya, nasa bahay ka naman din. So ang gagawin ng estudyante, magdidiskarte na kung paano siya kunyaring nakikinig sa klase habang naghuhugas ng pinggan. In other words, lahat ng mga stressors sabay-sabay. Isa pa, I mentioned earlier dun sa presentation ko that merong mga developmental tasks na kailangan gampanan ang isang individual para umandar from one stage to the next. Ano to yung apat na to? Self-identity, independence, peer relationships, no, and something else. Paano mo mapupunan lahat ng mga yon, magagampanan yung apat na yon kung nasa loob ka lang ng bahay? For example, paano mo gagawin ang self-identity na hindi ka naman makapag-express ng sarili mo? Hindi ka makapag-ayos ng ayon dun sa palagay mo ay tama para sa iyo. Hindi mo, with all the borloloys or the giring-giring dyan, wala. Lagi kang nasa bahay, so ang suot mo lagi pambahay. Anong self-identity meron ka dun? No? Self-image, yun isa pa. Paano ka magkakaroon ng magandang self-image? It's an extra challenge to have a healthy body right now, because as I mentioned in the presentation, all the unhealthy food choices are available, tapos walang opportunity for physical activity, no? Tapos it's all the milestones, no? When you say milestones, hindi lang naman yung maglalakad at this age, magsasalita at 7 months. Even teenagers have milestones. Paano yung prom nila? Paano yung high school dance nila? Paano yung mga school fair? These things, linulook forward yan as milestones of and rites of passages ng mga teenagers. Lahat yan nawala. So let us be careful in being very dismissive at sasabihin napakadali lang naman ng buhay ngayon. Bakit isa pa, adolescents are hardwired. They were programmed talagang yung may picture ako kanina slide na lumipad na sisiw from the nest. They're hardwired at this stage not to try to launch away from the nest. No? Pre-programmed by nature, no? And lahat tayo aalis from the magulang. We try to veer away from the magulang at pupunta tayo sa peers. Paano tayo gagawin yun gano'n? Nakakulong tayo sa bahay. Hindi natin ma-meet yung mga kaibigan natin. Tapos yung mga kontrabida, I say it in quotation marks kasi later on pagdating mo ng young adulthood, babalik ka naman sa magulang mo eh. But during teenagers, ang kalaban mo, ang mga kontrabida ng buhay mo ay pamilya, yung magulang mo. Ngayon, 24/7 mo silang kasama kasi pati sila naka-work from home. So you can just imagine how stressful it is to be a teenager during this time.
Sir, what I get from your answer is that they are very overwhelmed because wala nang compartmentalization na nangyayari. They have things to do, they have things that they want to do. Pero parang lahat yun sabay-sabay nilang kailangan i-face. Sir, Doc Jimmy, how about this one po from Mapes Quinones naman? Sabi niyo po kasi kanina na magandang practice yung let go of emotions before going to bed. So, how are we going to do that, or how are we going to help our kids do that?
It has to be a conscious effort, no? While we have to recognize yung feelings and emotions ng mga tao, we also can gatekeep, no? So we have to make a very conscious effort na kapag nandito ako sa aking place of rest, perhaps it is best not for me to think of stressful thoughts, no, or the stressful experiences of the day or experiences nitong nakaraang mga araw. It has to be a conscious effort na you have to distract yourself with other more productive or more positive na mga influences. And
ano pong example kaya nito? Journaling kaya? Kasama po kaya yan?
Yes, journaling can be cathartic, no? So if you get to write down your feelings and then tapos it's not enough that you journal eh. Dapat you have to make a conscious effort then to make journaling positive. Kasi paggagawa ka lang ng journal and then sabi mo cathartic naman eh, di sulat ko lahat ng mga hinagpi sa buhay ko, no? Parang i-replay mo at paulit-ulit mong babasahin yon and then magiging mahirap din, no? So what I advise my adolescent patients, there has to be a conscious effort on your part to try to count your blessings. Also think of the reasons to be thankful for. Yung mga patients ko, I always tell them, isa sa mga assignments lagi nila, think of 3, just 3, tatlo lang naman eh. 3 reasons to be thankful for today. Kahit ano pa man yan, kahit napakasimple na umorder yung tatay ko ng ganitong pagkain na paborito ko. O, di ba? Or yung lagi namin nagloloko na internet buong araw maayos yung signal. No? So that simple reasons, if you want to make a journal, go ahead and write down your kung ano man yung sa loobin mo, but you also have to make a conscious effort to recount ano ba yung mga things to be thankful for.
Doc Jimmy, this is different from just being positive or thinking positive, ano? Pero pag recount talaga to, being mindful of the positive things in life.
Yes.
So thank you so much, Dr. Jimmy, for answering those 2 questions. May we request Doc Faith to go back para po masagot itong question natin? Kasi this one actually merges your session and Doc Faith's session kanina. Doc Faith, are you here?
Yes.
Okay.
I'm here.
Hi, Doc Faye. Hi again. So this is the question. Very alarming yung rising ng teenage pregnancy stats. Ano kaya yung kanilang unique challenges right now? This question may be answered by both Doc Faye and Doc Jimmy. Sino po ang gusto mauna?
Si Ma'am Faye na muna. Kasi
Okay.
Okay,
yan si Ma'am.
I was looking at that same question do sa Q&A natin, ano. So ang ano kasi meron ding parang may ano doon na yung socio-demographic profile. So it's more gear yung incidence or prevalence ng teenage pregnancy ngayon mas nasa lower socio-economic group, ano. So napakaraming problemang kaakibat yan. So aside from yung hindi pa physically developed yung nanay, no, to carry a new being in her, di ba? So marami ring mga katulad na yung mga binanggit ni Doc Jimmy kanina na mga developmental milestones for adolescents. Syempre pinagdaraanan din yan ng isang buntis. Hindi naman hiwalay yan eh. So merong pang mga immaturity sa ibang organ systems even in the cognitive aspect. So extra yung siguro yung pagdaraanan ng especially ng mommy, no? So hindi yung iba rin kasi yung issues with the teenage partner, usually teenage din partner nung babae. So sa side ng mga teenage na nagbubuntis, napakarami. So issues on physical, mental, and even emotional well-being are actually part and parcel of the burden. So even before the pandemic, malaking problema na ang kinahaharap ng isang batang ina, no? So to speak. So idagdag pa dyan yung problema ng pandemic ngayon, especially yung access sa healthcare. Karamihan sa kanila hindi nakakapag-check up, hindi nagsasabi ng maaga na sila ay buntis. So hindi namin nakakatch early yung mga complications as compared to mothers who are already mature and are ready for this new phase in their lives.
Thank you for that, Doc Faye. Meron po ba kayong maidadagdag, Doc Jimmy?
Yes, I agree with Dr. Faye, kay Ma'am Faye na even prior to the pandemic, this has been a consistent problem with regards to the teenagers, yung teen pregnancy. In 2000, around 7% of all live births are from the teenagers, those less than 20. 10 years later, in 2010, naging 11.6. Noong 2014, it became 12. So far, wala pang latest data, but you can readily assume na the trend is on a pataas. Just to give you an idea what those numbers mean, it means that in 2014, that's 70 years ago, 575 babies are born to teenage mothers every single day in the Philippines alone. 575 babies per day are born to teenage mothers, no? So just to give you an idea kung bakit siya nagiging problem. And there are so many factors, no? You have to look at the teenager as a whole, no? Not just the individual, but on an ecological point of view. Ano ba yung pamilya niya? Baka naman masyadong permissive yung pamilya, baka absentee parents yung pamilya. Sino ba yung mga friends niya? No, sino ba yung mga nakakahalubilo niya? Nasa ang community ba siya nakasama? No, ano ba ang school niya? Ano ba yung values na tinuturo or lack thereof ng eskwelahan niya? And then on a national level, what are the services being given by the government? Sabi ni Ma'am Faye, what are the laws that will protect our teens, no? Tapos isa pang reason kung bakit tumataas yan even prior to the pandemic, you have to realize na our world unfortunately is very enabling, no? Look at media, no? Parang everything is sexualized, no? Yung mga jokes supposed to be on prime time sometimes are very loaded, no? you can think, I'm sure you can think of so many examples in the internet, no? Before, ang sabi ng American Academy of Pediatrics, dapat daw ang computer nasa ano lang daw, nasa office ng bahay, sa library ng bahay, or sa living room, yung ano to, yung common place. But that was during the time of the desktop. Ngayon, kahit maliit na bata has his own handheld device. Tapos napakamura ng connection sa internet. So anyone can talk to somebody else anytime, from anywhere, and talk about anything. So wala nang gatekeeping, no? Tapos prior to the pandemic, di ba? There is dati naka-dorm ang mga estudyante. Kung hindi siya nasa bahay ng nanay niya, nasa isa siyang dorm na merong anong tawag doon? Dorm master or dorm lady,
Dorm manager.
Dorm manager na tagabantay na may matinding orders na beyond this point walang dalaw, beyond this time bawal ang dalaw, no? Otherwise curfew ka, tatawagan yung magulang mo.
Yeah.
Pero hindi. Ngayon lahat nasa condominium. No? Ang dami mga condominium dyan, and then nandun ang mga adolescents dun sa mga estudyante sa condominium na hindi, ang gagawin lang naman ng guard, ilag sila sa logbook. That's it, kunin yung mga ID. Pero I'm sure you've seen teenagers, couples, groups who would go to, papunta na doon sa elevator, dadasalin mo na lang sana nga assignment lang or group work lang yung gagawin nila, no? Tapos everything is sexualized, no? Ngayon even yung mga burger, pag i-advertise nila some sexy lady in red, kakagatin ng with na very suggestive, no? So the world is very enabling, no, with regards to these, and it becomes incumbent upon us as adults to really be vigilant dun sa pag-alaga natin sa ating mga teenagers.
Marami palang factors kung bakit tumataas ang teenage pregnancy sa bansa natin ngayon. Thank you so much, Dr. Jimmy, for that insight. Ganun din kay Dr. Faye na nag-comment pa rin sa ating chat box na kahit sa TikTok videos ay hypersexualized. And I agree.
Pero Miss Faith, alam mo, ako rin ay tulad kay Ma'am Faye, I'm waiting for the latest na mga statistics, latest numbers, especially with regards to the pandemic. I wonder kung gaano kataas ngayon yung teenage pregnancies, because at least with regards to the patients that I've encountered, karamihan sa kanila, a big majority, almost all, their first encounters and actually the subsequent sexual encounters nila, wala naman silang pera at saka bawal sila pagbata, bawal ka naman mag-check-in sa kung saan. Wala naman silang mga sasakyan. Marami sa kanila ang mga experiences nila happen at home, sa bahay, kapag umalis yung mga magulang at walang ibang tao. Now, given na parang buong bayan ay naka-work from home, parang I think somehow magiging hindrance ito para makagawa sila ng mga milagro. I just wonder, just like Dr. Cagayan, what might be the latest na mga statistics ngayon?
Dagdag, Faith, Jimmy, Dwayne, dagdag ko lang ha, ang isa pang naging big problem during this pandemic is access to reproductive health services and goods, and that will include as well family planning methods. Kasi nagsarahan yung mga di ba hindi tayo nakakalabas. So, syempre meron tayong mga late adolescents, yan yung mga 17, 18, dati meron silang kahit papaano natuturuan pa natin about family planning and birth controls. Hindi lang enough yung turuan about birth control, but also their access. And hindi kulang ang ang mga ganitong serbisyo, talaga nagkulang ngayong pandemic. So yung mga we might be thinking of adolescents na medyo bata pa, pero marami kasi, di ba, Doc Jimmy, ang adolescents natin in stages as well, early adolescents and late adolescents, no? So parang hindi na nga ano ngayon yung mga 16, 15, 16 years old, parang wala na lang sa kanila yan sa totoo lang. So, yun. So, napakahirap talaga. Parang hindi na rin nila naiisip na malaking problema pa rin ang magdala na maglabas ng isa pang supling na ikaw mismo ay hindi pa mentally developed, cognitively developed, and emotionally stable, and even financial, no, to care for another being.
Doc, alam ko medyo na-late na tayo sa ating target time, pero I don't want to end with this note. No? Siguro mas maganda kung panuhin natin ating mga doctors kung paano na nga ba, kung ganito yung ating setting ngayon, paano na nga ba ang gagawin natin? How will they learn about reproductive health? Sino po ang gustong sumagot?
Serye 3.0. Hindi, we continue doing what we're doing now. Doc Jimmy, ayun, may nakita nga akong invite, Doc Jimmy, sa mga public schools, health services. I think we continue what we are doing now. We utilize all available platforms to forward our advocacies, no, especially teenage health, reproductive health, health in general for the whole family. So lahat ng pwede nating katukin, even to lobby amongst our probably our politicians, kung meron tayong mga iniisip na mga yan, sabi ni Doc Jimmy, yung mga batas siguro para sa mga bata, no? Para matulungan ng kanilang mental health, para bawasan ang mga anxieties nila, kung meron pa mga may isip na mga paraan. Napakaano kasi ang lalo na mga estudyante natin ngayon, napakahirap mag-manage talaga ng mental health ng mga bata, as it is ang taas-taas na ng suicide rates even before the pandemic, di ba? Pataas na. So I can imagine now, Doc Jimmy, kumusta ba yung mga kumukonsulta sa iyo tungkol sa mga ganyang klase ng problema?
Yes, ma'am. Initially, nagkaroon ako ng reservations dahil ang mangyayari online, no? So sabi ko, baka pumonte yung patients na mag-avail ng services. But then to our surprise, ang dami nila, no? Madami both because tumaas yung stressors nila, so marami talaga yung naging pasyente. Tapos dumami on a positive note because actually yung pagiging online became easier access for them, no? Dati kasi sabi natin, ay naku, napaka-impersonal ng online na like yung mga telemedicine or teleconsultations or yung telecounseling. But then that's from our point of view who are digital migrants, pinanganak na walang internet tapos later on na lang nag-internet. The millennials of today or the Gen Zs of today are digital natives. Pinanganak sila may internet na. Tapos with social media and yung lockdown restrictions that they have nothing else to do but be in front of the computer, they've somehow been very much acclimatized to the computer and socializing in the computer. So to answer yung sagot kanina ni Miss Faith, na anong gagawin natin? I think it's ang hirap ng buhay ngayon with the pandemic. I think it's really a matter of changing your perspective. Imbes na tignan mo siya half empty, tignan mo siya half full. Tignan mo siya as a opportunity to help, no? Dati yung mga ganitong mga talks, magi-invite ka sa kung sa anong hall, tapos kung sino lang yung mag-a-attend, makaka-attend at makakapunta dun sa hotel hall na yon, convention center, sila lang ang makakausap mo. But right now with this with the advent of the mga Zoom webinars, sabi nga ni Ma'am Faye, let's just continue what we're doing. Let's do more of this 3.0, 4.0, kung anong numero tayo aabot, and then maximize the use of technology so we can do each of our advocacies.
Okay. Thank you so much again, Dr. Jimmy and Dr. Jimmy Tumlao and Dr. Faye sa Madan, Cagayan, for sharing your insights, your expertise, and your precious time sa ating kalusugan ngayong pandemya. Okay. Again, thank you so much to our speakers, but also thank you to our participants who are still with us up until this point, and also to our sponsor, Cetaphil.
Right.
At bago tayo matapos ay magkaroon muna tayo ng rundown of the events of batch 1996 of UPIS. What are those? First we had our virtual kickoff party, and then our virtual race last April. After that, our 90s virtual concert in August. Also, our webinar last June kasama ating mga doktor. Next slide, please. We also had our support activities. We had a distribution of free face masks among UPPGH healthcare workers. Next slide, please. And if you want to be part of their fundraising, you may donate by scanning this QR code or go to upisthebest.com /donate-using-PayPal. And finally, look out for our upcoming event, our UPIS Art Fair 2021. Again, thank you so much for being here with us, ating speakers, participants, and sponsors, Cetaphil. Thank you so much, Dr. And for our organizers, the UPIS Batch 1996. Well, we haven't forgotten about our raffle. Of course, baka kinakabahan na iba. Hala, nanalo ba ako? Hindi. Well, these are the winners for our second batch. Everyone acknowledged except for one person. So we will have to replace P. Chua with Aloyra Beatriz Camacho. Tama po, no? Aloyra Beatriz Camacho. So if you are here, kindly send us your details. And lastly, for our feedback, for the participants, you may give us your suggestions, your feedback, because a feedback form will be available after this webinar. When you close your Zoom, it will pop up your screens when you leave us, no? We hope that you learned a lot from our Magbidahan sa Kalusugan ng Pamilya Ngayong Pandemya webinar, brought to you by UPIS Batch 1996. Sir Dwayne?
Yes, thanks everyone for joining us today. Our speakers, Dr. Jimmy and Dr. Faye, all of the attendees for the day, thank you for joining us. And please continue to support us. We have, as Faith showed earlier, we have some more upcoming events to keep you all engaged and aligned to our cause. Thank you so much for everyone who has supported us thus far.
And Sir Dwayne, also you can access the feedback form through our chat box.
And also may question pala kanina dun sa sa Q&A about the recording for this. You may we will upload the recording of this webinar session in our Facebook page, UPIS Batch 1996, and the website as well, upisthebest.com. Yeah.
And thank you again for being with us, for attending Magbidahan sa Kalusugan ng Pamilya Ngayong Pandemya. This concludes this Batch 96 webinar series for the year. Again, this is Faith Navarro, your host.
and Dwayne Bernardo.
We are now signing off. Have a good
Bye.
afternoon.
Happy 26
Bye.
sa mga batchmates ko.
Thank you, Sir Jimmy.
Di pa kita nakita, Shilet.
Huwag
Ano
muna
ba itsura mo?
Magpi-picture taking muna tayo as a group para documentation.
Jimmy, kabatch mo pala yung kapatid ko.
Yes, ma'am.